Hey everybody, talking a little bit more about when surgery is the right option for plantar fasciitis. And the first thing I want to talk about this is basically the last point. I want to say that I very much try to push people away from this procedure because it's not a fantastic procedure as far as outcomes go, but it does help patients reduce their pain. It's just that some will have better outcomes than others. And I typically say to my patients, who will be coming through with that 7 or 8 out of 10 pain, that my goal is to reduce their pain in half so they're able to undertake their activities during the day with as minimal pain as possible. And that's something that can be quite confronting to our patients. There's definitely a lot of great research around the conservative options, and although they're very effective and they're going to be helping over 90% of our patients, there's that small group of people that may require a surgical option in the end. Now, I'm very happy to see people for the second opinion and to help with some of that conservative, non-surgical and the advanced conservative with respect to some of our injections and our more expensive equipment like our photobiomodulation laser therapy, but really having a greater look at these sort of options is important. Now, for patients that are coming through, they're typically having ongoing pain, high level pain, whilst also undertaking all of the conservative therapy as we've listed in other videos. They're unable to wear shoes or finding that they can only wear shoes that are very supportive with their orthotics, and they don't have any ability to undertake extended walking or to not wear those shoes. Now, they've got pain for typically longer than that 18 months. And the research guides us to say that 90% of people will have resolution of symptoms after 18 months, or they may be having recurrent episodes of pain. And at those sort of points, that's when you say, okay, is it debilitating enough to potentially look at surgery? These patients aren't able to undertake all their activities of daily living or in some way impeded in doing so, to the point where they're like, okay, I'm just going to be sitting down every 10 to 20 minutes rather than standing or walking around or undertaking the life that they're wanting to. And these are great reasons for having that opinion to potentially undertake surgery. But like I said, I try to talk people out of surgery as much as possible for this. Some people do have great outcomes that are very good from day one, but most people will have an extended recovery where it's not exactly where we want to be, but a lot of people will get really good outcomes. It's just meeting that expectation at a 50% decrease in pain, and if we get something more than that, then I'm over the moon. And I think that's the best way that I can say that I talk to my patients as well. And a lot of the time we do get better pain relief, but I just want to be absolutely sure in making sure that we get all of those non-surgical options exhausted before we do look towards a plantar fascial release there as well. So hopefully this has given you a little bit of further information. I'd love to hear your comments around this for those that may be undertaking surgery, maybe referring or seeing patients with this type of condition. In the meantime, hit the subscribe button, have a look at some of our other videos, and we'll see you in the next session. Cheers.